Hello, welcome to Chapter 1. In this video lecture, we're going to be discussing some of the credentials, the organizations, and other aspects of the health information management field. So we'll dive into what is the health information management profession, particularly from the American Health Information Management Association perspective. The early history of HIM, or as we commonly know, health information management, came out of the hospital standardization. This was a program started by the American College of Surgeons to raise the standards of surgery and meet minimum quality standards. And as a result, health record processes were created. The forerunner for the American Health Information Management Association was the Association of of Record Librarians. This was created back in 1928. Now, of course, we know the organization as the American Health Information Management Association. And with that, we had approval of a standard curriculum, a more formal education, and credentialing and certification process. The first program was approved in 1934, and the Commission for the Accreditation of Health Informatics and Information Management Education, known as CAHIM, came into being. That is independent, but has a relationship to accredit health information management programs, and an accredited program through CAHIM is considered to be the gold standard for accreditation. And related to that, how we go about approving and becoming accredited requires a little bit of history. First of all, we need to have these education programs approved and be able to demonstrate a certain amount of knowledge and skills or competencies. And then related to that, we have a certification board that creates eligibility criteria for certification. In other words, what we're looking at is how are people going to be eligible to sit for these AHIMA credentials, being the RHIT exam that you're able to sit for when you finish our program here at Lane, or the RHIA program, or the credential, if you will, or the CCS, right? And related to that, this certification board is the Commission on Certification for Health Informatics and Information Management, or CCHIM. And why should you take a long, hard look at being credentialed as opposed to just getting a degree and working on your own? Well, a credential allows individual permission to practice the profession. An registered health information administrator, or RHIA credential, is considered analogous to like a bachelor's degree in health information management. The registered health information technician is typically an associate's degree level. Without a RHIA or RHIT credential, most people cannot manage a health information management department at a local hospital or get into other specified roles such as privacy officer, coder, medical record auditor, and so on. So it's really worth everybody's while to make sure that they're pursuing a credential. And that's one reason why I recommend that people pursue the associate's degree so they can sit for the RHIT exam. And again, where do RHITs and RHIAs work? Well, typically, most of us used to be hospital-based. We'd work at places like Stanford or Riverbend, right? And we knew such things as record content and processes, storage, retrieval, terminal digit filing. And while we still may deal with these, the practice has evolved away from the hospital where we dealt with paper charts and has become increasingly more electronic health record oriented and increasingly involving more and more remote work. And again, when we talk about managing, it's also evolved from managing individual employees, supervising, if they will, to managing information, managing data sets, making sure our data is clean and accurate and reliable. And the focus is more on information over processes and information governance versus just making sure things are done. One of the things that's becoming more of an issue, particularly now with AI, is informatics. In other words, how data, information, and knowledge can be used in healthcare and relating to big data and AI and large learning models, how we can use that to have better outcomes. When we talk about data analytics, we're taking a look at raw data and making conclusions. And how we use that data is using technology to manage it. So an example of this would be we have a certain amount of vital statistics, as you'll see, right? Somebody gets admitted to a hospital, there's a certain amount of data that gets collected and gets reported to the Oregon Health Authority, reported to CMS, and so on. So the data use is basically using that technology to get our partners in the federal and state government praised of our data. And again, what we see with the future of HIM, we'll see the field becoming more and more electronic. We'll see interoperability already just in the last, I'd say 3 to 5 years. We're seeing more and more different EHR vendors able to share data between Epic, say, and NextGen or Cerner, and this trend will most likely continue. In terms of today's profession, AHIMA is striving to be a more member-focused organization. We have people that work nationwide in terms of education, certification, and just in the time that I've been in the profession, I've seen it evolved from being something very paper-based with very little data analytics. Everything was, the little that was done on a mainframe, where now it's changed. So that kind of leads into lifelong learning and continuing education. Related to that, we have the mission, vision, and code of ethics. A mission, if you think about it, is why an organization like AHIMA exists. A vision is where we want to be, and the code of ethics covers the types of ethics we want our members to follow. And we have several different levels of membership in AHIMA. I'd strongly encourage people to become student members. Please reach out if you want to become a student member. It is relatively inexpensive and allows you to save a lot on everything from certification exams to textbooks that we use here in our program here at Lane. We talked a little bit about CHIM, but we also have a board of directors, much like the board or any other organization that's responsible for making committees. We have a House of Delegates, we have staff, we have a chief executive officer, just like all the other national organizations, and for that matter, private industry. Here are some of the credentials that you can get through AHIMA. We talked about the Registered Health Information Administrator. We have people that can sit for the Certified Coding Associate, which is an entry-level coding certificate. And we have the Coding Specialist, CCS, that does hospital coding. We also have the CCSP credential, which is the same thing except more directed towards physician offices. Then we have healthcare privacy and security, health data analyst, and clinical documentation improvement practitioner, which we'll talk more about in this course. And once we have one of those credentials, we need to maintain our certification by completing a certain number of CEUs. A lot of these are free. Some of them are done in person. Some of them can be done remotely. Some involve taking a college class, some self-assessment tests, and others. We have a fellowship program, and AHIMA does a great job of supporting training and education and has a career map that's going to be posted on our learning management system for you. And just to kind of recap what CAHIM does, it accredits health information management, health informatics programs, involves writing both a self-study or self-assessment, as it's sometimes called, and having a site visit. Then we have some other professional organizations. And again, these are not mutually exclusive. I myself am a national member of the National Cancer Registrars Association. We also have the Healthcare Information Management Systems and Society, the HIMSS, the Association for Healthcare Documentation Integrity, AHDI. Some people you may know of are members of the American Academy of Professional Coders, AAPC, and so on. And that's all I have for you. Thank you for watching, and we'll see you online. Bye now.